next.
Yep, or hit next so it preps it. Well, hold on, you want to have it up before you?
Nope. I think it's this.
You have to hit go live.
Yeah.
Remember to have it in the shoot. How we doing? We're just about to get started. Instagram or YouTube and everything.
Got it.
We're good. We're live. Well, thank you everybody for coming in today and tuning in for our special Facebook Live, YouTube Live, everything live event that we're doing on healthy tips to maintain great posture if you work at a desk. So what I'm going to do today is I'm going to just go over 3 main tips and kind of different screenings that we can pay attention to in order to have healthier postures. Now, if we're going through any of these and you notice any discomfort, any aches or any pains or anything like that, that's going to tell us that we want to get this thing evaluated by a professional licensed chiropractor because it tells us we might have a structural problem going on. So the first thing that we always want to pay attention to is something that's called upper cross syndrome. Most people nowadays call it text neck or computer posture. But what happens is when we get on the computer, most people tend to roll their shoulders forward to get onto the keyboard, and then their head starts to creep a little bit forward as they're paying attention to their monitor too much. And what happens is the neck muscles on the front side tend to tighten up and they get a little bit facilitated. Then the muscles on the back side start to get stretched and pulled and weaker. So we love telling a lot of patients about Brugger's posture relief pattern. So if you're in a chair and standing in a position at your computer, you want to roll your shoulders back, drop your shoulders down and bring your palms out so you kind of look like this. Then you're going to tuck the chin back so you're like this, and you want to hold that for about 15 seconds. Now, if you're doing this and it feels really uncomfortable, you want to get checked by a chiropractor because that's telling us you might have something going on structurally, either in the cervical spine or in the upper thoracic spine. Now, the next thing we want to look at is your computer monitor setup. Now, the average distance between the center of your screen and the computer monitor should be just about 20 inches away, right? Because if your monitor is too far away, that head's naturally going to start creeping forward. So if you have to take out a ruler and measure, should be right at about 20 degrees, then the up 20 inches, excuse me. Then the other thing we want to see, the center of your monitor should be about parallel with the ground, so that way you're not looking down and chronically flexed like that, and you're not looking up too high. Because if we see the monitors either too far away or too low or too high, we can start to get headaches, we can get upper neck stiffness. And if you tend to get a lot of headaches after using the computer all day long, or at the end of the day, your neck muscles feel really fatigued, that's a sign that you probably do need to get checked by a chiropractor because you have something structurally going on that's irritating those tissues. Now, the next tip I want to talk about is keyboard height. We don't want to see your keyboard out way too far in front of you, off to the side where you're going to be rotating too far. And in the same respect, your computer keyboard shouldn't be really close up on you where you feel like you're scrunching everything back. You should have a nice relaxed angle with a slight amount of flexion at the elbows to where your wrists are nice and calm. You shouldn't see the wrists extending back down here. Our wrist shouldn't be down here because it's too low and we're trying to type way too far down. That's going to put a ton of strain on the nerves that exit from the neck and go into the hands. So a lot of times if we have keyboard problems, patients who suffer from carpal tunnel syndrome or get radiating pain that starts in the neck and travels down into the arm, even right into the shoulder blade itself, those are all indicators that you could be a candidate who would really benefit from chiropractic care. So if we went through any of those postural assessments and you did notice any discomforts or you feel just things aren't right, get in. One of the things that we're doing for those who are listening up on today's webinar is we've got a new patient special for you. If you message us directly, either through Facebook or Instagram, use the code DESK19 and we'll get you guys hooked up with a special new patient offer. We can have our staff reach out to us. Just shoot us your information with DESK19. So that's what we got for you today. Now in 2 weeks at the same time on the 18th of April at about noon, we're going to be having our next installment, and the topic's going to be on healthy gardening tips, because luckily this weekend is looking fantastic. We're going to have 70-degree weather. People are getting outside. We want to be able to help make people enjoy their time and not be full of aches and pains while they're doing yard work, while they're gardening and doing the things that they love. So thanks for tuning in this week, guys. Have an awesome weekend. Stay healthy.